Okay, here's something that's very exciting, and that's new therapies and what's in the pipeline on new drugs for MS. Dr. Howard Weiner and Dr. Leslie Weiner, please help us.
Okay, thank you very much. There's a lot of new things happening as far as MS is concerned. The drug that was just approved that people are asking a lot of questions about is BG12, and we're going to have to talk about that because there's a lot of questions related to that, and I can take that on. As far as new drugs that are in the pipeline, so one of the drugs that's in the pipeline is a monoclonal antibody that's directed against B cells. There's a drug that's been used called Rituxan, R-I-T-U-X-A-N, Rituxan, and that showed positive effects. They're testing a new monoclonal. I'm sorry, it's called ocrelizumab. I'm sorry to have to give you these crazy names, but it's O-C-R-E, ocrelizumab. M-A-B means monoclonal antibodies. And this is in a phase 3 trial, and I think this is going to be the next drug that gets approved for MS, called ocrelizumab, O-C-R-E, ocrelizumab. You could put it in Google, you can read about it, and it's the same thing as the Rituxan drug, or the rituximab. This is given by infusion, and you may be just taking 1 or 2 infusions a year of this particular drug. So I think that's one of the next drugs that probably is going to be approved.
How is that different from Rituxan?
Nancy asked, how is that different from Rituxan? It's slightly different in terms of the antibody itself, but it's basically the same because it targets B cells. So it's not that different. It's basically like Rituxan, but may have a different kinetics. But I think that's going to be the next drug that you'll hear about. We just had the BG12, the Tecfidera approved, and we'll talk about that in a moment because there's a lot of questions. There's a drug, anti-LINGO-1, which is also a monoclonal antibody, which is trying to help remyelination, but that's a little farther down the road. So I'm going to mention those two, and I'll let Dr. Leslie Weiner talk about any of the other drugs in the pipeline.
There is a drug called laquidamide, which was tested in a phase 3. Does not seem to have as good an effect on the inflammatory response, so that the relapse rate improvement is not as great as some of the other medications, but it did seem to have a neuroprotective effect. It is being retested at a higher dose, but the major thing is that when you study cognition and the MRI of the patients that were tested, it seemed to have prevent the degenerative phase of the disease. So we think that's worthwhile. Then there is a monoclonal which is in a phase 3 right now, alemtuzumab. The MAB is the monoclonal part of this. So these are all antibodies against a particular marker, usually on lymphocytes, but could be on other cells. The alemtuzumab is given once a year. It was developed at Cambridge in England, and it is very, very effective, but the more effective these drugs are, the more you worry about side effects. And about 30% of the patients who have gotten alemtuzumab develop a thyroid problem, sometimes serious, most often just related to Hashimoto's and can be treated. There have been platelet abnormalities, which are also autoimmune. So what has happened with the alemtuzumab complications have been other autoimmune diseases. We're testing, we're one of the test centers, but I think it will be before the FDA shortly. It is used right now and is licensed for bone marrow transplant patients who have leukemia and lymphoma. So it is a major immunosuppressive agent, but it's once a year, and the patients from Cambridge, some of them have been off treatment for about 5 to 8 years, so it has got a permanent effect. It's so permanent that many of us worry about it. So that's in the pipeline, and that will be before the FDA. It may or may not be approved. The liquidomode is going into another phase 3 component as well. There are 2 new medications that we've been prescribing and which are licensed. One of them is Aubagio, which sounds like a dance, but it is a offshoot of an anti-cancer drug, and it is taken once a day. It's a pill. You need to be checked for TB, and again, we always worry about PML with all the drugs that suppress the immune response. PML is a complication of a virus we pick up in childhood, and about 55% of Americans still have that virus, even though it doesn't produce any disease until you alter the immune response. The other drug is Gilenya, which many of you know about, which is a whole new class of medications. Right now, its major effects have been that it is a very effective drug. It's a small molecule. It gets into the nervous system, and quite clearly, it is quite effective. We have a major screening process. It produces macular edema in people who are susceptible, so you have to have that checked. There is a lot of other side effects that we worry about. There have been chickenpox, disseminated chickenpox with it. So those are things that have to be checked and perhaps vaccinated against. Those are the major ones. There is another one that we are in the process of testing, which actually comes from Boston. It's a federal trial, which is a drug that is actually licensed for arthritis, which we are now testing for MS. And what it does is interferes with antigen processing and immune response. It is unfortunate that it's a placebo-controlled trial when we have all these other drugs, so it is difficult to hold off treatment of a patient when you know you have all these things out there. So the people volunteering for this are people who just don't want to be on anything else for the most part. But I think those are the major phenomenon, and I'm going to let the other Dr. Weiner. You know, we were related about 150 years ago, but not recently, not recently.